Hello, you're welcome. My name is Dr. Chris Williams and I'm your host on Well Again. Well Again is an online health magazine program in which we look at fail-proof principles and protocols for regaining health and retaining health. You're welcome. Today we are discussing how to prevent prostate cancer. But maybe before I go on, I should do some definition of terms. What is the prostate? The prostate gland is found in men. It is the gland that produces the semen. Okay, you know, when men make love and then they ejaculate, that thing is called the semen. The semen is the carrier of the sperm cells. Okay, it is produced in the prostate gland. Now, cancer is simply when a cell begins to behave abnormally. Normally, a cell has two major characteristics. Cells are born, and then they have a definitive date they are born or created, and then they have a definitive date that they die, and then they are disposed out of the body. That's number one. During their lifetime, whether it's in days or in months, they replicate. They have a regulated way of replicating. Those two characteristics are the characteristics of any normal cell. Many other things. Now, those two, as regards those two characteristics, cancer cells are different. Cancer cells have a particular day when they are formed or born, but they disobey the law of death. They refuse to die, so they keep living on, and then they also multiply during their lifetime, but they multiply in excess. So you have cells that are multiplying much more than the normal cell, and when they should die out and be disposed out of the body, they refuse to die out. Now, that is what cancer is. So prostate cancer is simply cancer of the prostate gland. All right. Now, it's by way of statistics, it affects about 25 men to 30 men out of every 100,000 men in Europe, in North America, and in South America. In China, it affects about 4 to 5 men out of every 100,000 men. Now, that's very important. In America, North America, and Europe, it affects about 25,000 men out of every 100,000. In China, it affects about 4,000 men out of every 100,000. In Africa, it should be affecting maybe somewhere between 7 to 12 men out of every 100,000 men. And that is significant. It shows that their lifestyle in China and Asia is something to emulate. We'll talk more about that. It's a slow growing cancer, and its 5 years survival rate is about 80%, 10 years survival rate is about 60%, and 15 years survival rate is about 40%. However, after 15 years, it begins to multiply very fast, and it begins to metastasize and grow to other parts of the body. Now, so what are the risk factors? What are the factors that expose us to cancer? Number one, high-fat diets. Eating of high-fat diets, diets that contain saturated fats. Okay, diets also that contain trans fats, or if you like, hydrogenated fats, margarine, butter, cheese, solidified fats. Okay, other things that give us high fat diets include red meats, processed meats, organ meats, and then some fishes, especially fishes that are not that do not have fins. Okay, fishes that do not have fins. Fishes that have fins are able to thermoregulate, maintain their temperature underwater with the scales. Okay, scales, sorry, not fins, scales. Now, fishes that have scales are able to thermoregulate with their scales, but fishes that don't have scales are able to regulate their temperature underwater with some deposits of fats under their skin. So most fishes that do not have scales, they have plenty of fats in their body. It's so important you know that. What other foods constitute risk factors? High sugar foods and foods that contain high carbohydrates, okay, or plenty of carbohydrates, or heavy carbohydrates, or if you like, high glycemic carbohydrates. That's refined carbohydrates, processed carbohydrates, wheat, flour foods, pastas, pastries, and then some foods that have plenty of carbohydrates, like some we have in parts of Africa. Most of our carbohydrate foods are heavy. Okay, for carbohydrates, I usually, if you like swallow like me, I usually recommend oats. And I said there are places where you can get bulk oats, and then you measure them in kilograms. You eat them as a breakfast, and then you also turn them into meals. If you need to know where you get those from, we can avail you of those information. Now, another thing that constitutes risk factor for prostate cancer is low intake of antioxidants. Low intake of antioxidants like vitamin A, vitamin C, vitamin E, zinc, and selenium. All right, and then also eating foods that have been contaminated with xenobiotics. What are xenobiotics? Such as pesticides, herbicides, and fertilizers. Okay, so there are things in these chemicals that are called xenobiotics, and others are called, two of them, xenobiotics and xenohormones. Okay, xenobiotics, let's call it xenobiotics. Let's just leave what to call it. Okay, so they are found in pesticides, they are found in herbicides and fertilizers. When they use these things on crops in the farm, these things enter into the plants, and if we eat them, they get to be stored up in our body, and they can position a man to develop prostate cancer later in life. Also, anything that causes high estrogen levels in a man can also predispose that man to developing cancer. Every metal poisoning with mercury and arsenic can also predispose to prostate cancer. Tobacco smoking and alcohol abuse of alcohol can predispose. Okay, doing shift work, or let me put it like this: anything that disturbs a man's sleep pattern, that makes somebody sleep, play with his sleep or joke around with his sleep. So people who do shift work, their circadian rhythm is zigzag. It is not normal. Okay, they have found in such people, their body is not able to produce melatonin like it should. Or people who decide to work all night long and they don't sleep during the day, or people who just joke around with their sleep. At night, your body begins to release an hormone called melatonin, and melatonin is very, very important in fighting back cancer. Not only prostate cancer, in fact, it's used for almost every cancer. Okay, melatonin, because it reduces stress. All those stress hormones that make your body fertile for developing cancer, melatonin brings them down. You produce it in your body, but if you don't obey the night of the law of the night is for sleeping, it stops your body from releasing melatonin, and it can cause a lot of problem. Okay, if somebody has a family history of prostate, it can also be predisposed to developing prostate cancer. Anything that predisposes to prolonged inflammation, and all these things we say we don't eat, don't do, all of them predisposed to prolonged inflammation, and inflammation is fertile ground for developing cancer any day, anytime. Okay, we have talked about exposure to xenohormones. Okay, xenohormones, xenobiotics, they are found in pesticides, herbicides, and fertilizers. Also, high prolactin level. There are some men, prolactin is the hormone that helps a woman's breast to be that big and to produce milk. Now, some men, it is in men, but it's very low. Now, some men have plenty of it. It is increasing some men, and that's why you see them, they are almost developing breasts like women. It is called gynecomastia. It can predispose to prostate cancer. Low intake of antioxidants. Low intake of antioxidants can also predispose to it. So what are the signs and symptoms of prostate cancer? All right, weak flow of urine. The person is trying to wee and the flow or the streaming is not very strong. It cannot travel. Frequent urination or inability to urinate at all. The person is, you are straining, but the urine is not coming. Burning sensation while trying to urinate, and then the person has to rush to the bathroom every other time, or blood or semen inside your urine. You are urinating and there's blood inside it, there's semen inside it. It's a sign of prostate cancer. Okay, so all these things can cause low back ache. It's another sign and symptom of prostate cancer. Now, what are the things to do? What must somebody do in order to fight back prostate cancer? The first thing to do is to do your some tests. PSA, the PSA level, normal PSA level is between 0 to 4 nanogram per mil or something. 0 to 4 nanogram per mil. Now, the closer it is to 4, the more it is telling us that something is right, something is not going right with your prostate gland. All right, that's very, very important. Okay, anything above 2.5 actually we should be concerned about a prostate. So another thing you should do is called another test that you can do is called free prostate. Okay, one is prostate PSA, which is the prostate specific antigen. Another test is the free prostate specific antigen. Another test is the prostate velocity or PSA velocity, prostate specific antigen velocity. All these things will tell you about cancer or not. It's so very important. Okay, that very, very important. So test to do again, PSA, prostate specific antigen, should be between 0 to 4 nanogram per mil. That's normal, but if it is above 2.5, that's something to tell you that you need to be careful about your prostate and your prostate life. Even benign prostate hypertrophy, there are two types of prostate enlargement, the benign and the cancerous. It will not put PSA beyond 4. So anything you do a PSA test and it is beyond 4, you should be very wary. It might just be prostate cancer. Other tests to do, free PSA, and then we said the PSA velocity, and then also the urinary PCA3. There's another one called pro-PSA. It's so very important. Now, some things to take note of. Between age 45 to 50, one can predict whether one will develop prostate cancer in future or not. So if you are between 44 to 50 years and you do PSA and it is less than 0.5, I mean, you are good. Okay. If it is 0.5 and above to 1, it means that you might just develop, it's not cancer, but you might just develop prostate cancer. And then if it is between 2 to 3, the risk is increased. Okay, and then if you are between 44 and 50 and you do PSA and it's between 4 to 10, most likely it is prostate cancer. You should do a free PSA, and then it will tell us what is going on there. It's so very important. A man should do his PSA test at least, if you are 45, you should do your PSA test at least twice every year, once in 6 months, because if you know it and you are able to start early, I mean, you will be able to fight better. So what should you do? What should we do by way of management? remove all the things that are causing it. That's how to always to manage things well. Okay, low fat diet. Go on low fat diet. Remove sugar from your food. Stick with low glycemic carbohydrates. I've talked. What are low glycemic carbohydrates? Oats, millet, maize, oats, millets, maize, beans. These are low glycemic carbohydrates. Okay, and then avoid foods that encourage weight gain. Avoid them. Okay, eat foods that encourage weight loss. Okay, and that have low calories. Very important. Avoid animal proteins, red meats, eggs, poultry foods, dairy products, fried foods, alcohol and sugar. Avoid them. Okay, very important. Stick with plant-based foods. So very important. Stick with plant-based foods. Very important. There's a doctor called Dean Onish, and he was known to have treated prostate cancer for many years only with vegetarian diet and exercises. Okay, so very important. What are the other things to do? Exercising is very important. Burn calories so that calories do not build up in your body. And then what are the other things to do? Supplements, foods and supplements. Grape seed extracts. It helps to, it's also a very powerful antioxidant. It helps. Okay, and then colored foods like tomato, red color, green color, colored food generally help to fight the fight against prostate cancer. Flaxseed is very good. Flaxseed, take flaxseed, blend it dry, put it in a can every day, 1 to 2 tablespoons. You put it in the water, you drink it. It's very good. Ginger is good. Soya is also good. Soya is good. Blend soya also dry. Put it in a can, 1 tablespoon in a cup of water daily. You drink it. It's really very fantastic. Green tea, if you are not dealing with hypertension, if you are not dealing with any heart condition, green tea is also very useful in burning fats and in quickening your mitochondria, your metabolism. It's very good. Cabbage, broccoli, Brussels, cauliflower, these are fantastic vegetables, and then you can blend these vegetables and drink them. I talk a lot about blending vegetables and drinking them, and many people call in, they say their blenders cannot blend vegetable and all that. There are a couple of blender types that we have worked with over the years and we can recommend, but I'm not going to call them now. If you want to know, contact us by WhatsApp and then we'll be able to tell you. Okay, if you get good blenders, okay, and then you'll be able to, they will last you. You'll be able to blend anything you want to blend. You can even use it. It even has a compartment as you are blending. It will remove the chaff from the water. Okay, cabbage, broccoli, cauliflower and Brussels. These 4 herb or vegetables are very powerful in controlling cancer, any type of cancer. They contain a substance called indole-3-carbinol. Indole-3-carbinol. Melatonin also, if you are very stressed, you should be on something or the other that helps you to replace or that produce melatonin in your body. All right, milk thistle, silymarin and silybum, it helps the livers to do its work so that calories do not build up in your body anyhow. Mushrooms like ganoderma, reishi are very important. Olive oil is important. 2 cups or 2 tablespoons on a daily basis. Olive oil is good oil. You just put it in your pap or something and then you drink it. Fish oil is important. Fish oil is very important. Pomegranates and berries contain ellagic acid. They are also very helpful in preventing prostate cancer. Saw palmetto is also very useful, and resveratrol, okay. Vitamin D and E are also very useful in preventing prostate cancer. And then zinc, and then exercising. exercising. Don't be a lazy man. Get on the street, exercise, so that you can you will not have to start battling cancer later in life. If you have developed cancer, it's been diagnosed, it is cancer has its treatment. We just talked about here things you can do to prevent prostate cancer. And if you are 44, you are 40 and above, you should take note of these things, and you should be doing them earnestly. Don't forget, I said you should check your PSA level twice every year, and then you should do these things, okay, so that you don't have to battle cancer later in life. If it is an established cancer, it's a diagnosed cancer, it has its treatments that contain of 4 or 5 things also, using of dietetics, that is food, supplementation, maybe we'll talk about it later, cryoablation, that's freezing the prostate cancer and till it dies and then it gets out of your body, or you use the guanine accentuation protocol, or they call what is called the GAP protocol, the guanine accentuation protocol, the GAP protocol. All right. Another thing that they use in the hospital are androgen activity limiting drugs and also androgen reducing drugs. There are many things to do about prostate cancer. Don't just keep quiet. If it's prostate cancer, we have dealt only with how to prevent it here. It's so very important. It's important that you know that the things we have talked about here are not prescriptions. They're just for your information, so that you know that these things are there to do. Very, very important. Do not forget to share. Do not forget to subscribe. Do not forget to turn on your notifications so that you can tell when we upload new videos. And then, of course, our books are here. Our books, they are very, very powerful and useful books. This one says, make your food your medicine. Make your food your medicine. It was out of stock, but it's back in print right now. Very powerful book. You can order these books. Reversing hypertension and cardiovascular diseases naturally. Also very powerful. It has helped many people literally around the world. Another one here is here, reversing diabetes naturally. Reversing diabetes naturally. So fantastic. And then there's this one. I love this book. All our books are powerful, but I love this one. Sickness free. Fail-proof protocol for regaining and retaining health. And then, of course, there is reversing depression naturally. Reversing depression naturally. We have some other books coming out, but when they're out, we'll be able to tell you about them. All right. Thank you so much for viewing today. Do not forget, we have not prescribed in any way. These are for your information only. All right. If you have any issues and you feel you need to use any of these things, it's important you talk to your doctor so that they can give you the permission to do so. Do not forget to subscribe. Do not forget to likes and give us thumbs ups, and then do not forget also to turn on your notifications, and then also share with your friends and your colleagues. I think if you have your brothers, if you are a woman, your husband, your brothers, in-laws, share this, throw this around, let people know it. You don't have to battle prostate cancer later in life. Okay, you don't have to battle. When it is cancer, it's usually a very dirty fight, and it costs a lot of money and a lot of pain. So before it can get to cancer, my idea is we can prevent it. Thank you so much for watching. Till I come your way again, this is Dr. Chris of Well Again saying bye bye. Thank you.